Really?
All right. It seems that the entry has slowed down a bit, so I think we can go ahead and get started. I want to thank everybody for taking the time on their Sunday evening to join us. We'll be discussing the reentry plan, what you can expect as parents and teachers. I see there's a few. So what can be expected moving forward, how we're reading the numbers, and what that'll mean for our school district. So again, I just want to thank everybody and remind you that this meeting is being recorded and will be on our website, on our school district update, sent out via remind, etc. So the way tonight will go, Dr. Bertolini will just give a brief statement, and then to lay out the plan, the pathway forward for our school district. And then we will reserve the rest of the time for questions from the audience. The way you'll do that is you'll just use the raise your hand function. I'll call on you, allow you to speak. You can ask your question. We ask that you please limit it to 2 hand raises or so per person, just so that way everybody has an opportunity to speak and ask questions. And of course, if you have more questions beyond that, always feel free to email either Dr. Bertolini or I. Our emails can be found on the website. So with that being said, Dr. Bertolini, if you want to give your statement.
Thank you, Bryce. Welcome, everyone, to another town hall meeting. We offer tonight an open discussion. If you have a question, as Bryce said tonight, please ask it. If you don't want to ask it in public, you can always call me during the day tomorrow or email Bryce or me. We want to remain as transparent as possible. We think that the weekly updates have increased our transparency. We also think that the board meeting agendas that are published in advance give us transparency, so you know what's going on at our board meetings and throughout the year. So we encourage you to attend our board meetings. We encourage you to read the updates. There's a lot of information in that you need to know is in either the updates or at the board meetings. So I'm pleased to say, as many of you know, that the 3 buildings have been open for most of the year. The middle school has not missed a day due to a need to quarantine the building. The high school has only been out for 2 weeks the entire year, but you know ACS has had 3 fully virtual 2 weeks periods because of cases in the building. Our mindset has changed. Now we're, as we said a couple of weeks ago, instead of worrying about our restart policy, it's more of a re-entry back into school as the pandemic finally lessens and we become more willing to open up the buildings. So instead of restart, we're talking about re-entry. Other school districts, some have been not in school since March of last year. Some have missed months at a time this year, where they've gone virtual only. And then other districts have scheduled cleaning days every week. So even though they may be open, they're always closed on a certain day for cleaning. We believe we can clean after school, and we've done that all year. So when we were in the middle school and high school, we're in 5 days a week. And the elementary school, since I guess late September, has been an A-B schedule. Just an update on quarantining status. The medical subcommittee met with Bryce and me on Friday to make sure that we're speaking the same language. And here's just some points of information. Students that are sent home with 1 of the major symptoms of COVID or 2 of the listed symptoms on the daily health form, they'll be required to get a negative PCR test. Or if they can't get a PCR test or don't want to get a PCR test, they need to remain at home for 14 days to quarantine. The New Jersey Department of Health has no longer accepted the alternative diagnosis as a way of coming back into school without a negative PCR test. Depending on the student's symptoms, the individual student's symptoms moving forward, classes may or may not be quarantined. That'll be determined on a case-by-case basis on the findings of our medical subcommittee. So we've lessened that to a degree, but again, the medical subcommittee, which we've used them all year long to give us advice, obviously they're more knowledgeable than any of us. They have the background. Dr. Yankis, Alita from the board, the Borough Health Office, and Linda Bernard have been our key people on the medical subcommittee. And this will be reviewed again as the color matrix changes. Right now we're orange still. We're hoping we'll be yellow soon, as part of the state is yellow now. We base it on our calorie report, which comes out every Saturday. So if you go to NJDOH and look up the calorie report, you'll see what we are. But right now, Northeast New Jersey is still orange. First contact students and their parents will immediately be notified. If you're not notified, that means that you are not a first contact. And when I send out a remind about a case in any of the schools, it is done after all contacts have been notified. And always remember that HIPAA regulations impact our ability to give out information. HIPAA requires confidentiality, and we're certainly going to meet those guidelines. I will, in conjunction with the medical subcommittee, look at each situation, determine if we need to quarantine a class or a school. But we will look at each case separately. We're not going to do just automatic. We will look at it, and I'll get the advice of Dr. Yankus, Alita, and Linda Bernard. Changes to date on how we started the school year and what we've gone to now. Since February 8th, both LMS and LHS has added more contact time and more days of contact for their students. The Ad Hoc Committee for Technology has agreed in principle for an update of our full technology infrastructure. You remember that was the key reason why we had to change ACS from everyday in-person instruction to an AB rotation. And as you know, pre-K has always been everyday in-person instruction. Looking forward, and this is what we really want to hear tonight, looking forward, what is going to happen in the near future and in the distant future. At ACS, beginning around March 22nd, we will pilot a plan of everyday instruction, beginning with our kindergarten and first grade students. For parents that select in person, the AB schedule will disappear for kindergarten and first grade. And these students will have 5 days of in-person instruction. For the people that choose virtual learning, it will remain the same, and they will have the current type of instruction with the teacher. To ensure that our technology is satisfactory, we have purchased hotspots for all in-person students for the remainder of the school year. If the tech plan continues to have the support as it currently does, and I'm hoping that it continues, the infrastructure in the district will be greatly improved by September, and there'll be no need to purchase hotspots. As I said previously, this is a pilot for kindergarten and first grade. Obviously, pre-K is already in. So the plan is at this point, around March 22nd, is to have pre-K, K, and 1 in person for the parents that choose it every day. No decision has been made at this point for the other grades at ACS. As I said, since it's a pilot, we want to see how it goes and then make decisions down the road on that. Some questions might be about snacks. Obviously, we do not allow snacks right now inside, but when the weather improves, which hopefully it'll start improving soon, we will revisit the idea of snacks outdoors to make it safe for everyone, including our staff. LMS and LHS have similar schedules, and this will continue for the remainder of the year, the current schedule. If the COVID cases go down, which we're hoping they are, but we're getting close to a yellow, but we're not there yet, we will look at adding an additional in-person class in the morning. If we're able to do this, students in both schools will see all 8 classes in 2 days. Some people will say, when do we return to a normal day? I'd like to take a moment to review what we said in the update a couple of weeks ago. The information about the changes in the schedule are often in the superintendent's message, so I ask you to please look at it every Friday, at least either in my message or in the general information, if you just want to know what's going to happen in the near future. In my thinking, and this is what I posted again 2 weeks ago, there are 2 major necessities that would bring us back to a longer day. The Northeast section, which we're part of in New Jersey, based on the calorie report, must show the region is either green or light yellow, closer to green than orange. Moreover, Bergen County, Leonia, and Edgewater must also either be yellow or green. A second point where we look at a longer school day, the vaccine must be easily accessible for our staff. I'm sincerely disappointed by Governor Murphy, who has emphasized the need to reopen schools, but has put smokers ahead of educators to get a vaccine. 28 states at this time put educators very high on the vaccination availability. At this point, New Jersey is not. So right now, Educators are not included in the people that can get a vaccination. And I'm really disappointed by this. Although Leonia has been open, unlike other districts, the vaccinations of our teachers will permit us to examine when we could extend our school day in person and how can we do it safely. Obviously, the health of our teachers is very important, and vaccinations is a way to do it. Hopefully, Governor Murphy will change that, and we'll be able to put our teachers into vaccination processes right away, and that'll quicken the movement to a longer school day. But right now, the governor has not changed his mind. Spring break. If you read this Friday's update, you heard what I was saying about spring break for our students. I just want to reiterate this so there's no confusion of what will happen if you travel during spring break. And this is what I said on Friday. As we move closer to spring break, I want to reiterate my words from November prior to Thanksgiving and the holiday break in January regarding the impact of travel on your child's education and participation in extracurricular activities and sports. As some of you know, I love to travel. Getting away from spring break is a normal annual event, not only for me, but for many of you. However, this, as you know, is not a normal school year. We've had to practice many restrictive safeguards since the introduction of COVID into our lives almost a year ago. Traveling to another state or country could put you at further risk for infection. In many cases, this travel will also result in a 14-day quarantine from school, resulting in the mandate to go fully virtual and the inability of participating in any school-sponsored event. So I urge you to refrain from any travel this spring, hopefully for the last time, because it will require a 14-day quarantine. There are states that have been designated as destinations to which New Jersey residents may travel without having to quarantine. These states are New York, Connecticut, Pennsylvania, and Delaware. And then finally, what will September look like? I'm optimistic, and assuming that we're able to handle these new variants that are impacting the country, I expect the schools to be fully reopened in September with masks on. If possible, we'd like to transition sometime this year so the students get used to the system. So we're hoping for September fully in person, fully masked, and we would like to start the transition as soon as possible. But again, we need the vaccines accessible, and we need the numbers to go down. We're either yellow or green. So at this point, Bryce, that's where we are. That's what we're looking forward to. And I'm opening the questions.
So just to for anyone who's joining, just to summarize, I guess.
Sure.
Where we are right now is that by hopefully around March 22nd, and the reason we're not being so specific on dates is because, of course, a lot of this depends on the Cali reports, how the state is doing in terms of infection, right? If we skyrocket, which the trends don't appear to indicate that we will, but should they, of course, we don't want to, overpromise what's possible here. We're just going by the data, and technology and spacing remains key problems at ACS, right? So even if we went back to 70% capacity, which we've only been at 60% this entire time, DOH guidelines, but even if we did, that's the whole emphasis for, their need to move the fifth grade. There's no room at ACS to begin with. So the problems at ACS are more unique than at the middle school and at the high school in terms of spacing and technology. But Dr. Bertolini and the administration have put forth a plan for K&1 to return for 5-day-a-week instruction by hopefully March 22nd. That'll serve as a pilot program. And based on how that goes, we can assess the other grades and hopefully move from there. So at this time, that is I guess the goal for ACS. And Dr. Bertolini laid out for the middle school and high school, adding a morning class, which will mean that each grade will be meeting all their classes over the 2-day period to increase face-to-face time for those students who do in-person learning. And then hopefully by next year, just to finish the summary, hopefully by next year we'll return to something that does resemble normal school, but maybe with masks, whatever the Department of Health is saying at that time based on the numbers of infection, the vaccine rate, etc. But we hope to see that New Jersey teachers are given access to vaccines. Of course, right now, teachers who are in the high-risk categories can get vaccinated. I know a few have, but wide access for our teachers is still something that is needed because they are at a much greater risk than the students are. So that's only, we're only looking at that as a pre-qualification for the regular day of schooling, which hopefully by September certainly shouldn't be a concern at that
Or
point.
even to extend the day,
Yes, or even to extend the day.
or sometime this school year.
All right, so we'll now open it up to questions. I see there's 2 hands raised. So the first person will be Joe. You should be able to speak. You should be able to speak now. Let's see. Wait, hang on. Oh, there you are.
Yeah.
Hi, Joe.
Bertolini, how you doing? Couple questions. Have we started getting our eligible teachers vaccines? I guess, am I gonna ask all of them and then you'll answer at the end?
Sure.
Is that how it goes?
Yeah, we'll take
No,
notes.
Okay. So yeah, I was just wondering, okay.
Joe, so it's
that's
not
what,
it's not
fine.
the regular format of a board meeting. So if you prefer us to just answer your question as you go, we could do
Yeah,
that. Or if you want us to answer them all at the end, either.
Oh, then that's, yeah.
Yeah,
If you, well, as we go, sounds fine. Yeah, so the first question is, have we started getting our eligible teachers vaccines? I know some communities, some school districts, there's as high as 50% of their teachers are eligible, which is amazing because there's, like you said, smokers, BMI, there's so many things, not just that 65 and older. And if you look at stats, actually 70% of the people getting vaccines are under 65 right now. So I'm just curious, have we been working with our teachers that are
Yeah, we're working with the town.
eligible to get vaccines?
Yes, Joe, we're working with the town and with our teachers individually, because obviously Leonia has a program, but it's just for Leonia and Tenafly residents. But we certainly encouraging our teachers to get the vaccines, and we are allowing them to schedule it anytime they can get an appointment. So if it's 8 o'clock on a Tuesday, we're not stopping them from going because we want them to get vaccinations. So we're encouraging them as much as we can. There's no, right now, they don't qualify unless they have an underlying condition. And we can't ask them what their underlying conditions are, but we're certainly encouraging them by allowing them to go whenever they get an appointment.
We're also hoping
Okay.
to have a vaccination day once supply is increased significantly.
Yes.
Right now, there's only and thank you to the mayor and the town, but the state has not given us a sufficient amount of supply to vaccinate our community's priority list and our teachers. But hopefully in the future, near future, hopefully with the Johnson & Johnson being released today or yesterday, we'll be able to have some type of coordinated day for teachers as well.
Joe, we're not going to, we will do anything that we can to get our teachers vaccinated because that's a very important step for us to get back to some kind of normalcy.
Got it. Along those lines, I was just saying, as soon as the mayor opens it up to everybody, do you have a team in place? Because I know you said like we're trying locally to get vaccines, but do you have a team in place to try to secure appointments?
Well, that'd be in coordination.
Appointments at Meadowlands and stuff.
No, that would be in coordination with our mayor, and we do not have anything right now with Meadowlands for sure. But we would hopefully coordinate with the mayor once availability becomes more quantity of it, and then also when teachers become available. We will do anything we need to do to get our teachers vaccine first. But again, as we talked about before, most of them are not eligible.
Okay, as long as you know that
Joe, you're going now.
once,
Joe, you gotta
yeah,
go.
once we're available.
We lost
Okay.
you.
Sure. The next thing, once they open it up to all the teachers and we become in yellow or green, how long after that, or what's the plan after that until we open to like full day?
We're going to go step by step, and I can't really make any predictions because I don't know when that's going to occur. I know that the elementary school parents don't really like losing a teacher because they've had a teacher for a good part of the year. So part of that will be discussion with the parents and surveying them and see which parents would rather be in person and lose their teacher, because there'll be obviously some movement of who's covering which class. But again, we can't predict too far in the future, but our goal is to safely bring our students back into the building with our teachers. That's our goal. That's our mindset. And we're not changing that, but we need to be safe and we need to be, our teachers need to be safe.
Okay. Sorry, and last question. So last meeting, board meeting, Dr. Bernalidi, you said that after the K-1 pilot, if all goes well, you're going to bring back second grade, and the older grades you weren't looking at.
Well, the problem, Joe.
Looking at all of those grades.
Yeah, the problem, Joe, is, as Bryce mentioned earlier, space. If we keep the class sizes down to 13 to 15, which is what we're right now, the guidelines say we need to have a distance. I know some states have gone to 3 feet, but right now the New Jersey Department of Education still says 6 feet. Department of Health still says 6 feet. So if we have 6 feet regulations, then it's hard to bring the 3rd, 4th, and 5th grade back because it's hard. There's no space for them because there's no empty rooms. And if obviously you have a class of 25 and you keep the max at 15, where we're going to put those 10 kids, and those 10 kids in each class is 50 kids that don't have a spot. So we're going to look at how K-1 goes. Also with technology, we have to make sure that we can handle it. We think we can. And if things go well, we'll move forward. We may move forward into 3, 4, 5, but at this point, I can't say yes or no to that. I don't want to give you misleading information on March or
Okay.
28th. That'd be incorrect to say at this point, we're going to bring back the whole school. I can't tell you that right now. Depends on how the pilot goes, how our technology goes, how the numbers go, and how the guidelines change. The guidelines change, it does open up to more students in the building.
All right. Thank you both. Appreciate it.
Thank you very much.
Thanks, Joe.
All right, next up, whoops, let me just lower the hand. Next up is Vito Mazza. You should be able to speak now. Vito, you just got to unmute yourself. Oh, there you go.
Good evening, gentlemen. Can you hear me?
Yep,
Yes,
we can
sir.
hear you.
Yes, sir.
Can you hear me okay?
Yes, yes, yes.
Wonderful. Thank you. I appreciate it. I'll try to be brief. I just want to clarify and make sure I'm understanding correctly. The guidelines for opening the public school is specifically coming from the state. There's no ambiguity between the threshold. None of those metrics are subject to interpretation. It's strictly by the state. Is that correct?
No, it's it gives certain guidelines, but they don't say, no, they're recommendations.
Some are.
Most are recommendations. The 6-foot one is still there.
So-
Yeah, but again, some states are changing it. New Jersey has not changed it yet.
Okay, so as far as the vaccine, which I jumped on just a moment early, but Bryce, I heard you speaking to it, and Dr. B, I heard you as well. I just want to understand something. Certainly, it's important for anybody that wishes to get a vaccine, teacher, staff, whomever, and obviously there's big logistical challenges happening.
Right.
Is what you're saying, if I'm understanding it correctly, and perhaps I'm not, is what you're saying the ability of every staff member that wishes to be vaccinated, having access to being vaccinated, is that a point of contingency to open up the schools?
Yes.
Well, for like a full day regular where they're moving, eating lunches in the schools, like a regular day of school essentially. Yes, they need to have reasonable access and time to get it. Yes, but if we're just talking about expanding the school day where there might be one transition of classes at the middle school and the high school, or we're talking about what we were talking about with the elementary school going back to 5-day a week for K and 1, maybe potentially down the road 2, and then maybe a bit further 3 and 4. That's we're not talking about the vaccine for that point. The vaccine contingency is for a full day of school, regular school day, full in person, regular school day. We're looking for, and this was after our conversation with the medical subcommittee, is mid yellow to and lower on the Cali report, and it comes out every Thursday if you're interested in checking it out. It's put out by the Department of Health, and it measures the infection rate, the positivity rate, I think the vaccine distribution. It measures everything by county and by sector of New Jersey. So below mid yellow on that, and then accessibility to the vaccines. And that's just for the, back to normal type day of school. Maybe we'll still be
Okay.
wearing masks.
Even for a longer school day.
Yeah.
It's not a full day, but it could be a longer school day. We have.
So then, understood. So going by the Cali report and including vaccines to the point I raised, is there a max, or I should say, is there a minimum requirement of the percentage of staff to be vaccinated?
No, because we can't.
Like, let's just say half of the people that want to be vaccinated, or half the staff wishes to be vaccinated, they have access, then that fulfills your requirement, or, in spirit, what you're trying to accomplish, which I understand. I just want to understand that there's not another bar being set somewhere that X% of staff would require a vaccination, medical
Vito?
decision that would then further delay.
No, Vito, the answer to that question is sort of the reverse. If the vaccine is easily accessible for our people, not necessarily they get it. If they don't get it, that's their call. But if it's easily accessible for our staff, that's the criteria that we're looking for.
Understood. So the board isn't necessarily taking a position that they should or shouldn't, but you want to ensure that they have access to do
Yeah.
as they see fit for their own
Exactly.
Yes.
personal medical decision.
If they
Understood.
decide against it, that's their call, but that's not going to slow us down in that regard.
I got it.
I
Thank
think
you for clarifying.
I think the recommendation that I've heard so far is that most school districts won't be requiring their personnel to get vaccinated,
But
but we encourage it. That's totally your call.
but it has to be
But it has to be accessible. Right now, it's not
Accessible.
accessible, and a lot of our teachers are, could be in the high risk category, and we want to make sure that they're safe when they're in the building for when we expand our school day beyond what we have now significantly.
And our teachers want to get vaccinated, but they're on the line every day trying to get an appointment, but right now they can't. So it has to get to the point where you can easily get vaccinated, and then that's a different issue for our decision-making process.
Understood. Thank you so much for the explanation. I appreciate your work, guys. Stay well.
Thank you very much.
Thank you, Vito.
All right, next up, Tom, you should be able to speak now. Tom, you should be able to speak.
No, it's,
And it says you're muted now. Tom, it says that you're muted. I'm clicking ask to unmute.
He's got unmute, I think, right?
Yeah, it's on his end. Oh, there you go.
There he goes. Should be there now. Tom, you there?
All right.
He should be there.
Yeah, it should be. Tom, we can't hear you. If it's on, I don't think it's on our end.
No,
If you want, we'll come back to you. Perhaps
check his volume, maybe.
check your volume, or if you want to call in on the phone, maybe.
Your microphone's on.
Yeah, on our end it says that you're not muted, and we can't hear you if you're talking.
Let me see if it's in the chat. No, nothing in the
We'll
chat.
leave your hand raised, and we'll move on to the next person. And if you can call in, call in. But it says that you're not muted here. All right, we'll move on to the next person, but I'll leave your. Lauren Pecorelli, you should be able to speak now.
Can you hear me?
Yep, we can hear you.
Yep.
Yeah.
Yeah, good. Thank
Okay.
you.
Just wanted to quickly say, Tom, if you
Okay, great.
stand up, and if you can call, but Lauren, we'll go to you now.
Okay, I had two just follow-up questions from what you guys had mentioned before. So with regard to the full day potential for September,
Mhm.
is the thought that you would still offer a virtual option, or that everybody would be coming to school in September?
That depends fully on the state. So right now, the edict of the state is that all school districts must offer a digital option for schools. So as long as they continue to keep that mandate, we will continue to have to abide by that mandate.
Yep. That's it.
Okay, and my other question is kind of a follow-up to that. So I think we can all agree that the sort of the format of the way things are taught this year is a necessary but less than ideal scenario. So I kind of wonder, and you guys have been talking a lot about like the need for, you know, technology to be on target, but my feeling is personally that in school, especially the younger ones.
Lauren,
And so I wondered if even, am I breaking up?
Yeah, can you just repeat what you just said?
Sorry, yeah. No, I was just wondering if, you know, the dependence on technology that we have right now for our younger students is going to continue into the fall. In other words, the kids, you know, who are in school are sitting in front of their computers watching videos as opposed to having live instruction. Because I really would hope that if we're going back to full-time school, that we can kind of get rid of that, you know, need to be in front of their computers all day long.
Lauren, just to be very frank, when we're talking about improving the technology, we're not talking about setting it up for, you know, so that way we can do digital in class. We're talking about making it work. Right now, it's not working, and the technology in our school district has been neglected for a very, very long time, and is not suitable for, you know, students to learn technology stuff in general, let alone even offer a type of digital hybrid option at ACS. So in September, we're not looking to have you know, your children sit in front of the computer all day. That no, it's going to go back to a regular type of instruction. But we would like to, you know, ensure that the technology aspects of the school are working, whereas now they're just not working. It'll still be included in everyday instruction. We're trying to just, you know, make sure that the infused technology that's already there is working and is accessible. And if the teachers want to continue to use technology in the classroom, they can. But at this point, they can't, and that's because of years of neglect to the tech infrastructure and investing in technology, which hopefully will change. But no, your children next September, you can take this to the bank, I promise. They won't be in the classroom staring at a computer all day. That won't be the
Okay,
case.
thank you.
Yeah.
The only other very quick question I had was just, I think you mentioned, Dr. Bertolini, that there's a small chance that this year the middle school children might have like 2 classes in person. Is that what you said?
yes, we have to, yes.
Okay.
There's certainly a chance. We want to transition in, but that, again, that'll be later in the springtime. If the numbers
Okay.
down, the numbers have to be significantly down for us to do that. And we've been talking about this for a while. Or if we have 4 classes a day for both the middle school and high school, that means every other day they'd have their class. So they would meet their teachers either on a, say, an A day or a B day. They won't go a longer time period not meeting their teachers. But again, the criteria has to be met that we were talking about earlier, which we hope it will. We with Johnson & Johnson coming aboard, we think that the vaccines will be much more accessible to a lot of us, and we'll be able to get it.
All right. Thank you both so much.
Thank you.
Thank you very much, Lauren. Tom, I'll come back to you now to see if it's I hope it's working here. Let's see. Here we go. Tom, we're allowing you to speak now. You should be able to. Wait.
If he just wants to call the office.
Oh yeah, that's true.
Yeah.
All right. So if this doesn't work, just call the board office. But let's see. We'll try it again. All right. So now you're back up here. Let's see, Tom. Can't hear you. Tom, do me a favor. Just call the board office. Ed, you want to say the number?
201-302-5200, and I'm extension 1200.
You repeat it again. 201-302.
5200.
5200.
And extension 1200.
Okay. So Tom, just call 201-302-5200, extension 1200.
Yeah, 1200.
1200.
1200.
1200. Because right now we can't hear
If
you.
for some reason you're not coming, I don't know, your microphone's on.
Yeah. So I'm not sure.
You know, is anybody else? Is no one else?
If there's any other questions, please feel free to raise your hand. We'll go to you, Tom.
Oh,
Here you come.
I
Here you're
think
coming
so.
in.
Hope it's him.
I hope it's you.
Leonia Schools, may I help you?
Oh, hey, Dr. Bertolini, Tom Garrett.
Oh, good. Okay, good. Yeah,
Here,
we can hear you.
One second. Just either raise the volume or move the phone so everyone else can hear it.
How about now? I can't move the phone.
Okay.
but-
Can you hear me okay?
Yeah, we can hear you. Okay.
We'll repeat the question for the audience if they can't hear you.
Okay, super, thank you. So I don't know what happened. I'm having technical difficulties because you can imagine what the younger kids go through when they try to do their Zoom puzzle. Well, I appreciate the effort you guys are putting into this. Obviously, we're coming up on the 1-year anniversary. The trauma and the stress on the elementary kids has really been just incalculable. So they really do need to go back. It's nice to see you're putting K-1 back. My question about not being able to go to the full day, is it because of the state 6-foot requirement, or is it more of a local issue that you have some teachers that are just reluctant to do the in-person? Or is it because you have too many parents in town who do the virtual, and therefore you have a staffing issue where you have to put them on virtual and not in person?
I don't think it really has, I don't think those are any of the points. I think it just comes down to, we don't want to have lunch in our buildings until the teachers are vaccinated and the numbers come down. Remember, we're still orange. We came back to school in September, we were green. And there were a lot of districts that didn't even come back in September, but we did. But right now we're still orange. We're hoping to get to yellow, hopefully in a couple of weeks, if not next week. But we're still nowhere near we were in the beginning of the school year. So we would like to be, our teachers to be vaccinated so we can have lunch in the building and we can have teachers move from one class to another. Remember the reentry committee, which used to be the restart committee, I felt strongly, and we've followed this throughout the years, and that's why we've been open for the most part, that we do not mix classes or mix teachers.
If I can just add something.
Yeah, sure, go ahead.
So one notable statistic during the medical medical subcommittee meeting was that Leonia schools, notably, our nurses and they have not found any transmission
Yeah.
in the school buildings. And that was because in the beginning, I credit Dr. Bertolini and the medical restart committee, one of the top priorities was ensuring that there wasn't crossing over between students and teachers. So that's I would say it's Department of Health guidelines, and then the conscious objective of making sure that students aren't crossing over as much as possible would be the reasons.
Right, and I think that just proves the point that transmission does not occur in the schools.
Well, it doesn't occur in our, but Tom, excuse me, it doesn't occur in our school because of the fact that we don't create a situation where we have cross-contamination. It does occur in other schools. It just does. The sports teams, our sports teams have been very successful.
But they've been the most restrictive.
Because we're the most restrictive. Our kids wear masks for sporting events. Other schools, and Dr. Yankus, our school doctor, is a doctor for another district in Bergen County, and he has to close sports teams down because they're not restrictive as we are. So I would say that we are not transmitting because we are very restrictive.
Okay, well, yeah, and you guys do deserve a lot of credit for putting the rules in place, and the kids do follow the rules. I just want to make a comment on the vaccinations, though. To have healthy 20-year-old and 30-year-old something teachers, have the vaccination before requirements go back to school, that's just not supported by the science.
Well, we're not requiring them. And again, the point we're making is that people that want to get back, teachers that want to get vaccinated, need the opportunity to get vaccinated. We are not saying that a 25-year-old that says, I don't need to get vaccinated, well, then that's not going to come into our equation. The equation is the teachers that need to get vaccinated, that want to get vaccinated, have the opportunity to get vaccinated. At that point, when that occurs, if an individual decides they don't want to get vaccinated, that's their call. They're not going to be able to slow our process down. But we're not talking about those 20-year-olds or 30-year-olds. We're talking about the teacher that wants to get vaccinated. And right now, if I didn't volunteer yesterday at the Leonia school, the Leonia at Rec Center, I wouldn't be vaccinated. I'm 63 and a half. I have a couple underlying conditions, but I don't qualify right now. So we need to get our teachers vaccinated. That's the point.
And I just want to add on to that as well and thank the board. We unanimously passed a resolution, one of the few districts, calling on Governor Murphy, and I'll be sending it out on Monday to all the board presidents in Bergen County and to the governor, calling on them to accelerate the process for teachers to get vaccinated. It is crucial that they just have access to the vaccine. 28 other states, including New York, are all allowing teachers to get vaccinated. and New Jersey is slow as heck to get that process for whatever reason. I would completely agree. It's essential to open up schools, but
And remember,
it's antithetical when they're not allowing vaccines for teachers.
but we got to remember too that when they're talking about opening up schools, they're talking about districts that have never been open. We've been open. Again, we've had to close down numerous times, but we've been open since September. There are some districts that have not been open since last March.
Yeah, and I know,
And we're not one of them.
tragically,
And we're not one of them.
And tragically, it's the districts that can least afford it with the poorest kids.
Yeah,
I
well,
know that.
yeah.
But my point, and I'll just leave you with this final point.
Sure.
My point about the vaccinations, gentlemen, is that there seems to be a fundamental misunderstanding of risk in the education establishment that, so many people have been going to work for months and months and months, and the kids do not transmit under 10 years old. And I understand the need to get the vaccines, but if the vaccines were not going to come out for 2 or 3 years, thankfully we had miracle scientists who made it happen. But if we weren't going to get a vaccine for 2 or 3 years, would we have kept the schools closed for 2 or 3 years? I mean,
Well,
come on.
Tom, that's just not the way it is right now. So we don't need to do hypotheticals. We just need to move forward in what we have. And we're looking forward. And when the teachers looking forward, we're again, our union, teachers unions has been so supportive this year. They have been cooperative. They've been responsive. They know we want to open our schools. But on the other hand, we do want to open our schools in a safe scenario. That's what we said back in August of last year. And we're going to continue to be consistent in our policies on making sure the schools are safe, not for our teachers also.
Okay, well, they are safe, but thank you. Okay.
Thanks, Tom. Thank you.
All right, thank you very much.
Rebecca next. She hasn't gone yet.
Oh yeah, okay. So 1 second, let me just lower the hand. Joe, I'm just gonna go to the other 2 people who haven't gone yet, and then I'll come back to you, Joe. So I see your hands raised, but I'm gonna go to Rebecca first, then Brian, and then I'll come back to Joe. So Rebecca, you should be able to speak now. Hopefully it works. There we go.
Nice background.
Hi, can you hear me?
We can hear you, yes.
Okay, I just wanted to say I was very happy to hear what you were saying about that the levels needed to be lower and the teachers need to have their vaccines before you're thinking about opening schools full time and having lunch. I think if you look at the CDC, a lot of people don't pay attention to that aspect, but lunch at school is essentially like indoor dining. Many of us are not comfortable with indoor dining, even though it's allowed. And if you look at the conditions for indoor dining and for cafeterias and eating in the classroom, that's seen as a higher risk activity. So I fully support your plan as you're moving forward with that. And also, I think that it's important to note that Leonia has been able to have more in-person school time because you've taken these precautions. So I have friends in other districts where they're moving classes in the high school, they're going to 8 classes a day, they're eating lunch in school, and they're constantly having to close because there are cases from transmission in the school. So I think by being cautious, you've actually allowed our students to have more in-person time. So I'm glad to hear that you're planning on continuing with that.
Thank you.
And I also just want to point out, there's, of course, our children, this is not an ideal situation, as Lauren said. And of course, our children and families want everybody to be back in school, but we still are dealing with very high levels of the virus. And so as much as we want to be back in school, full time, we have to realize that that's going on. And I think also some children are actually doing quite well considering the circumstances. Many children are learning quite a bit this year. Many children are happy to see their friends in school, even though they have to be 6 feet apart and be in masks. They're seeing their friends in the playground, outdoors. So I don't think it's a complete disaster for our children. So again, I really appreciate the way that you've been approaching it. And then the one question I had was, I was wondering if you think, I don't know if you can say what the likelihood is of any of the 3rd through 5th grade going back 5 days. I mean, I don't actually mind. I have a 4th grader. I'm not pushing for her to go back 5 days a week, but I was just curious if you think that would happen. To me, it's more concerning. I'd rather her stay with her current teacher for the rest of the year, her 2 teachers. I think it would be more disruptive if she had to change teachers, and it would negate some of the benefit of going back to school 5 days a week.
Um, I don't think we can speak to the likelihood necessarily of 3, 4, 5. It really is going to just depend on what the numbers are, what our technology is at that time, and then of course spacing and staffing. And we will certainly be in close touch about it with our families and parents about it when that time comes. And I would imagine we'll be looking at it if we're talking about KM1 pilot in March. It'd be closer towards the end of the
Okay,
year.
well, I just
Um,
wanted to stress, like, I think the importance of thinking about keeping children with their same teachers, because there has been so many other things changing. And for elementary school teachers, that really is really important. Children, that is really important.
Well, just to clear this up, if we do decide in K1, we are going to ask the parents what they want to do. So and if we ever got to the point, which again, I'm not sure how likely it is because, especially because of the space, we want to see how K1 works first and then go review it at that point. But the parent will have a decision to make whether, if we do go to that, even with second grade, whether or not they want to change their teacher to be in person. So
Well,
that'll be a choice you make down the road.
but if a child is already like, if the percentage of people changes, people who didn't request a change might still get a different teacher. So,
Yeah.
I just wanted to stress, like, thinking about keeping the kids with the same teacher as much as possible.
We agree with that and we understand that, and that's how we'll move forward.
Thank you.
Thank you very much.
Police and Atkinson.
So Ed, though, just so that for people who are listening, if you could, I guess, elaborate on what the K-1 is going to look like compared to September, perhaps.
It won't be where there'll be virtual and in-person students together. They'll
Right.
be in the classroom. They still might be using a Padlet for introductory lesson because that's how they've been working it. But then the teacher in the classroom will take over. So it'll be more like.
It's not a hybrid. It's not where you have.
No,
You're
no.
either fully digital or you're fully in person. I just
Yeah.
want people to understand that the K-1 pilot is going to be full in person if you're in person and full digital if you're digital.
As I said,
Yeah.
the AB schedule, when a student is in person now, the student will have 1 day of in-person on, say, A day, and then B day, they'll have their virtual teacher on B days. This will change. They will have one teacher every day in person.
All right, we'll go to Brian, then Olivia, then back to Joe. So Brian, you should be able to speak.
Hi, can you hear me?
Yes, we can hear you.
Thank you, Bryce. I'll be quick. I just have a quick comment. I just wanted to say thank you to you and Dr. Bertolini for everything and trying to get our students back to school. This is obviously a really challenging time that no one saw coming. And I think through all of this, you guys have been very transparent, regardless of some of the sad things that have been said on listserv and other places. I think your communication throughout all of this, through reminds and updates, have been appreciated by a lot of us. So just please keep it up for all of us.
Yep. Thank you very much, Brian.
Thank you, Brian.
All right, we'll move on to.
Joe, probably. Joe, Olivia.
I said we'll go to Olivia, then Joe. And Joe will go to you even if somebody else raises their hand, I promise. So
That's probably Joe, Leaf, probably.
this one.
Yeah,
Olivia.
Hello?
Yeah. Yep. There's also Joe, right?
Hi, my name is Joe. I'm speaking on
Yeah.
Hi, Joe.
my wife's phone, Olivia. So the question is about the older kids at ACS.
Yeah.
Have you considered keeping the kids, having the kids go, just have them go half in the morning and then half in the afternoon? That way they could still keep their own teachers, and the space is alleviated by only half of them going in the morning and half of them going in the afternoon, with a break in between for the teachers, and enough time for janitors to come in and disinfect or clean or whatever they do.
Well, remember, you have to have, yes, Joe, we're going to look at that again. We are doing K1 first for a reason. We want to make sure not only do we have the technology, but do we have the space? you're talking about 4 hours of instruction. They usually go 3.5 hours of instruction. That doesn't give a whole lot of time for cleaning. So we have to figure that all out, but we're not going to move forward unless we can do that. But again, it seems simple, but it's not as simple as you say. Again, because of the time period that you need in school to count it as a day and to be able to clean thoroughly in between. Again, as somebody said, I think as Rebecca said earlier, we've been successful in keeping the schools open because we've been very restrictive, and we're not going to start cross-contamination without a solid plan in place. We're just not going to do it. And we're going to get through this year, and we're going to move forward, and we're going to try to bring kids back to school as much as it is possible in a safe manner.
Joe, do you have a question? Do you have any more questions?
No, I wanted to know about what I just remarked on. Thank you.
We're going to look at it. I'm not saying we're not going to do it, but we need to see how K1 comes back first and see how it works, and then we'll address it after that. We'll evaluate as we go along.
Yeah,
I understand. I think it's important to get the kids in school. We have the middle school that go for an hour and a half to 2 hours. They don't have to go for 4 hours if they don't need to. But I do think that you guys are doing a good job. It's up to you to make that determination. Thank you for your time.
Okay,
Thank
thanks,
you, Joe. I'll just add, a lot of it, when in the past 2 years, we've been discussing moving to 5th grade, it's really because ACS is packed. And when we're trying to limit spacing, right now, we're trying to limit it to 15 kids or so. There's no question we cannot do that. Have everybody come back in for the upper grades and do 5 days a week and space. So
And clean,
I'm
and
great.
clean, and
And
clean.
yes, and clean. So I'm grateful that the board has voted to move the 5th grade come September. The construction and whatnot is already beginning. Kevin Woods' team has already been gutting the middle school media center, not the entire middle school. So it'll have brand new classrooms for September. So that way there'll be added spacing we'll have a reduced population at ACS by over 120 so kids. It'll solve the spacing problem there. But at this point, before we can do that, we are definitely facing a spacing issue. So as Dr. Bertolini said, it really just depends on the numbers and those Cali reports. They do come out every Thursday. They're available on Department of Health's website, and we will go based off those. Okay, Joe, you should be able to speak again.
Yes, just one more point I wanted to bring up. I know you were saying some of the teachers are having difficulties getting appointments, which I know that's a blanket statement. Most people are having difficulties. Are you able to leverage volunteers like myself and others in the neighborhood that have a great ability to follow people on Twitter and stay up to midnight and secure multiple appointments daily for our neighbors? Are you able to utilize that, or is that a privacy issue?
Ed perhaps can speak to the privacy issue aspect, but I did see that there were a few parents on one of the parent Facebook groups that were talking about helping. I don't know if it was teacher specific, but we're talking about helping parents. Talking about helping getting people appointments who needed them. But Ed, perhaps you can speak to the privacy and whatnot.
I don't know if that would inhibit a teacher from giving that information out. I don't know. I haven't thought about that, to be honest with you, Joe. It's a good point. I can speak to John Sassy, the union president, tomorrow, and figure out if we can help out. I know a lot of our teachers that go on, there's different sites. They're talking to each other, go on at midnight. That's when they drop the open spot. Yep. So they know of it, just that we've been, we've had some vaccinations, but it's not anywhere near. They say, what's the percent in the state?
I was just checking the numbers. It was fully vaxxed. No,
13% or no? 7%?
I think 15% have been fully vaccinated. No, 15% have gotten one shot in New Jersey, and 15% of the country has been vaccinated. 75 million shots have been delivered thus far.
But we're hoping that Johnson & Johnson changes the equation, because that's a lot of vaccine doses that are going to go out there, and it's only one shot. So that makes it better. But we will review it. I speak to the medical subcommittee pretty often, actually. I don't want to say daily, but almost every day. And we will evaluate it as we go along. We are restrictive in what we do, but in being restrictive, we've been good. but we want to open the schools. Everyone wants to open the schools. No one wants to close the schools and keeps the kids virtual. But again, we've been in person most of the year for all 3 buildings.
No, I think you guys are doing an amazing job in trying to get to 5 days, even if that's no lunch. That's a great goal, at least for this year. I just want to like reiterate, Bryce, you saw that's Olivia and Stephanie, friends of mine that have been helping out numerous neighbors. They did actually 31 neighbors in 48 hours.
Wow.
So, and they have other volunteers. I spoke to them yesterday waiting to help, but they don't even have enough people to help. So if you give me a list of 10 teachers, we don't need insurance cards, we don't need social security, basically date of birth and name, we could get them appointments in a couple days.
But Joe, why?
Someone's eligibility, isn't it, still?
Well, yeah, but he's talking about for teachers.
Yeah, if they're eligible, yes, correct.
So-
But I can't, they don't have to prove to us they're a smoker. We're not gonna ask them to get on a scale. They have to tell us this is what it is, and we will get that appointment. There's no documentation they have to provide to us.
Joe, why don't we do this? Why don't you send an email to Ed about the details, and he'll reach out to the union president, John Sassy, and maybe we could try to coordinate something where we could get volunteers helping teachers who are eligible get vaccinated appointments in Leonia. That'd be great.
They want to get vaccinated for many reasons.
Yeah.
For their safety, they want to get vaccinated. So not just for being in school, but they want, the vaccination.
Yeah, that's what I'm saying. When we have so many volunteers that really want to help out, we got to utilize these angels we have.
Yeah, I've been following that on listserv too. That's a great program that you guys are running.
All right, I'll follow up with you. Thank you.
Thanks, Joe.
They're texting me right now because they're on the call. They're like, please CC me on these emails. So you have a force behind you trying to help the community.
Okay,
That sounds great, and thank you to all volunteering in that regard. All right, let's see. If there's anybody else who has questions, please use the raise your hand function. This video has been recorded and we'll be posting it on our website. Dr. Bertolini will send it out in his update. And I just want to remind everybody that you can always call or email the board office or email board members or Dr. Bertolini. Our emails are always open. It's just first name for board members. It's first name dot last name at BOE at BOE.
BOE.
Leonia schools, right?
Yes.
Without writing it, I'm not too good at this. Sometimes you got to write it. You can always email us your questions, and we'll be happy to get you responses. Just to recap our meeting so far, if anybody has questions, please feel free. But just to recap, on or around March 22nd, we will be launching a K-1 pilot for K and 1. So in total, it'll be pre-K, K, and 1. We'll return to 5-day-a-week learning. 6 through 12 already do 5-day-a-week hybrid style learning, but pre-K, K, and 1 will do in-person 5-day-a-week learning. It'll be separate from virtual learning. It won't be the same. It won't be hybrid like at the middle school and the high school. It'll be separate. So if you're in person, you are in person. If you are digital, you are digital. And then based on that and how the numbers go, we may expand, we may not. Hopefully we do. We'll just have to wait based on the numbers and technology, again, spacing and staffing for second grade. And then based on that, because that's an even bigger grade, we will.
Second grade is a large grade.
Second grade is a large grade. So based on that, we will look at 3, 4, and 5. And then hopefully for September, we
can't give false hope to 3, 4, and 5. It's
Right.
a problem with spacing.
No, absolutely. I don't want to give false hope to 3, 4, and 5 because the problem, as Ed just said, is spacing is a big one. That's why, again, we are doing the 5th grade to the middle school. It's really just because spacing. And of course, spacing and a pandemic don't mix well. But hopefully for September, we will see a normal day of school because teachers will have had, and teachers and education personnel will have had access to the vaccine. And by then we can open up, students can move around the classroom, move from class to class, have lunch in person, perhaps wear masks, get screened at the door. And of course, for 6th grade and up this year, we're looking at, in terms of expansion, expanding to 2 classes in the beginning of the for the in-person part of the day. I see Lauren Pecorella just raised her hand. So Lauren, I see you raise your hand. Feel free to ask you should be able to speak now.
Yes, very quick. I just wondered if you could remind us what the criteria are for closing down an entire school,
That's
and
correct.
if that criteria might change. And my main reason is that I feel like there have been times when the whole school is closed down, but my kids, like, their actual classes hadn't been affected. And so I wondered if there's a thought to kind of
Yeah, Lauren,
lower the threshold.
yeah, you might have missed what I said earlier today, but that's okay. I said that instead of automatically closing, the medical subcommittee is going to sit down with me and we're going to discuss a case. So there might be times where we have to close the whole building, but there'll be times that we don't close the whole building. So we are less restrictive than we were a couple of weeks ago.
Yeah.
So
just I think
Okay, thanks.
it's no longer going to be automatic. It's going to be on a case by case basis now.
but when we need to, we will.
Yeah.
Is that-
Yep.
yeah.
I think that. Was there anybody else who? Let's see. Is there anybody else who raised their hand?
Lauren's hand still is like.
No, I just.
You just make it down.
All right. If there's no one else raising their hand, I guess we could just stay for a second here. But yeah, so I'll just continue with what I was saying. So 6th through 12th grade, we're hopefully looking for this year to expand. So that way they have 2 classes in the morning and then 2 classes in the afternoon. Lunch is the break where they would go home or get bused back to Edgewater. And then again, come September, our hope is that by then in New Jersey, we've expanded vaccines to teachers. I'll be
Well before that.
hopefully, yes, hopefully well before that. But certainly in September, hopefully the vaccines are widely available to all who want. And we will have a normal day of school and your kids will be able to eat lunch in school and they won't be in front of computers all day. And that would just be a dream, but hopefully a realistic one. And that's the goal. And I want to thank all of our, of course, one group that I want to thank in particular is our grounds team, our custodians and janitors who have been working tirelessly to keep our buildings clean. And they've been really putting in a lot of effort to make sure that Leonia schools are clean and sanitary and safe for our students. And of course, I also want to thank our medical subcommittee. They have just been incredible. Alita, the public health nurse, and Leonia, Linda Bernard, and Dr. Yankus. They've all been tremendous. And lastly, of course, I have to thank our teachers who, compared to other districts, there are districts with lawsuits between boards of education and between their teachers union. And in our district, it has been great working with our teachers union. And I think because of that, we've had a very successful year, of course, comparatively to other districts. And I think it's so important that boards of education, administration, and teachers unions keep these good relationships. So that way, when emergencies like this come up, we're keeping strong relations. So I hope we have someone with their hand up. Jessica, you should be able to speak now.
Hi. My question is, I was a little late to this meeting, so I'm not sure if you've already answered the question. What if next year, starting in September, even if the teachers are eligible by then to get vaccinated, if they choose not to, and there's a large amount of teachers that choose not to want to return?
That's their choice. Right now, the problem is it's not they don't have a choice one way or the other. But once it becomes their choice and they've had reasonable period of time to get their vaccines, and then it's the ball's in their court, so to speak, and that's their choice.
And also, the only school that has virtual teachers is the elementary school because of the technology issue that we faced earlier in the year. The middle school and high school, the teachers teach a hybrid form of instruction. So there's really very few virtual teachers in our district. But again, I don't anticipate that. Our teachers have been very professional all year long. We've had open communications. We've had discussions with the union, sometimes disagreement, but we've been able to work it out. So for the students in our district, and I would, if a teacher decides not to get vaccinated, they have to still come to work, and they will. I'm very confident about that. I don't anticipate any problems. But again, we need to get our teachers vaccinated. So if you have in with Governor Murphy, give him a call and tell him to get the teachers move up to 1A or whatever, what it is, to get our teachers vaccinated right away. But if that happens in September, we will deal with it like we dealt with it last summer. But I do not anticipate, first of all, the teachers refusing to come to work. But if they refuse to come to work, that's their choice, and I don't think that's going to happen.
Okay, thank you.
Thank
You're
you. I think that, the biggest unknown variable for us right now, at least from the conversation with the medical subcommittee, is these new variants that are coming up, of course. But on the bright side, it seems that with the new style of vaccine, these mRNA vaccines, I'm not a good science person, but from what I understand, they're pretty easily changeable. It's almost like computer coding, from what I understand. So like Moderna and Pfizer can hopefully. I'm not a science person, but they are, and they know what they're doing, hopefully. And that's the biggest obstacle. But again, hopefully for September, with the vaccine, with wearing masks and whatnot, and we'll still be doing screening in September. So you enter the door, we'll screen you for fever still, and other things like that. But
That's down the road.
that's down the road, exactly.
That's
That's
right.
down the road.
But I'd like to add one more thing
Yes, please.
before we close. I just wanted a shout out to the mayor and Alita
Yes.
for organizing the event yesterday. It went really well. I know that they fought hard to get the vaccines, even though we didn't get as many as we wanted. I knew it took a whole lot of effort, both the mayor, the Alita, and also I believe Sam, the health official, also to get this to work. All the volunteers that were there yesterday, it worked really well, and I just want to again a shout out to both of them.
Yes.
For their efforts.
Absolutely. Yep, I second that. All right. If there's no further questions, we'll give it another minute. If there's no further questions, we will post this recording shortly. But thank you all for attending this evening for our town hall. And as things change, we'll have another one if things change significantly from this. Close towards the end of the year, hopefully, because I can't imagine the numbers will change that quickly. But again, thank you very much, everybody, for attending tonight. And good night.
Good night, everyone.
Good night, everybody. Have a good one.